Tonight I propose the emergency plan for AIDS relief.
It was 20 years ago when former President George W. Bush made a plea before Congress at his State of the Union address.
I asked the Congress to commit $15 billion over the next 5 years, including nearly $10 billion in new money, to turn the tide against AIDS in the most afflicted nations of Africa and the Caribbean.
Fast forward to today, Bush, who came to Washington to mark his plan's 20-year anniversary, says the program to provide life-saving treatment to millions of people living with HIV and AIDS was a success. The president's emergency plan for AIDS relief, or PEPFAR, is due for reauthorization this year.
This program needs to be funded. And for the skeptics, all I ask is look at the results. And if the results don't impress you, then nothing will impress you.
The success of PEPFAR boils down to the numbers, says David Kramer, executive director of the Bush Institute.
Over 25 million lives have been saved as a result of President Bush's PEPFAR initiative. And it was a vision that he had to step in and help people who were in real need of help. He felt the United States was in a position to do so.
Since the legislation was signed into law in May 2003, PEPFAR has benefited from bipartisan support in Congress, even though its abstinence programs, a requirement later removed, had drawn criticism. Former President Donald Trump proposed to reduce PEPFAR's funds during his term, but was unsuccessful. Winnie Byanyima, executive director of the Joint United Nations Program on HIV/AIDS, or UNAIDS, recognizes PEPFAR's impact.
When he announced PEPFAR 20 years ago, our people were dying. Our countries were devastated. There was fear, there was pain, there was suffering. So we come here to honor President Bush, the American government, the American taxpayers, for $100 billion that has been put in this program.
She also says it was partnerships that formed between PEPFAR, the Global Fund, UNAIDS, civil societies, and governments that helped to turn the tide.
Thank you for your compassion.
Former President of Tanzania, Jakaya Kikwete, who joined Bush at the event, recalls getting tested publicly to encourage others who were afraid to do the same.
So the best thing is for my wife and I to lead by example. And we should not do it under the tent where nobody sees it. Of course, my veins were easy, but my wife had some problem. They pricked her several times before they could get the... I was very sorry for her. But we said that's the price of leadership.
With a target of ending AIDS by 2030, stopping new infections is a must, especially given 2021 data, says Byanyima.
Sadly, we had 1.5 million new infections worldwide, most of these in sub-Saharan Africa. We had 650,000 people who died in 2021 of AIDS-related illnesses.
Not one of those new infections and deaths had to happen, she said. Mariama Diallo, VOA News, Washington.